Welcome, I'm Terry Tropin, and today I'm discussing the new CPT codes and guidelines for 2022. I'll cover a number of different body systems and changes to the surgical guidelines. Changes for the cardiovascular and musculoskeletal systems are so extensive that they have their own separate videos. Those are already up on this channel. I'll talk about which body systems specifically I will cover in a minute. But first, let me tell you a little about myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus and have RHIA and CCSP certifications. I'm also an AHEMA approved ICD-10 trainer. I have taught health information technology at Montgomery College for over 20 years. I've also written books on coding. These books are study guides that summarize the coding guidelines, which, as you know, can often be confusing. My books include one on E&M coding, one on CM coding, and one on PCS coding. Now, the CM and PCS books have already been updated for 2022, and the evaluation and management book should be up in the next week or so. These are available on Amazon and updated every year. Now, if you enjoy this video, please subscribe to the channel and click a like for me. I would really appreciate it. So, what are we going to talk about today? Well, these are the sections that I'm going to discuss. I'm going to talk about changes in the surgical guidelines, the integumentary system, the mediastinum and diaphragm section, respiratory system, digestive system, urinary system, nervous system, eye and ocular adnexa, and the auditory system. So lots and lots of changes to talk about. Let's start with the guidelines for surgery. These guidelines are between the last anesthesia codes and the general surgical codes beginning with 10021. So a new section in the guideline describes the difference between a foreign body and an implant. A foreign body was intentionally placed in the body. So the example I have here is a hip replacement. This was done intentionally. And if something is unintentionally placed in the body, it's a foreign body. Now, I don't know how a key got here, but it did, but it's not supposed to be there, and it certainly wasn't placed on purpose. Or if it wasn't, who knows? But it's not supposed to be there. However, if an implant or part of an implant moved from its original position or breaks and no longer serves its intended purpose or it presents a hazard to the patient, it becomes classified as a foreign body, unless there's specific guidelines for that circumstance that state otherwise, or there's a specific code for removal of a broken, moved implant. So generally, put there on purpose implant, not put there on purpose foreign body. So let's start with the integumentary system. Code 11981 has been revised, and a new note was added under the code. So you see in all of the changes on here, I have crossed out what has been taken out for 2022, and I have underlined the stuff that has been added for 2022. So 11981 is a good example. Non-biodegradable was crossed out in this code, so the code wording has changed. A note was added, this is new, for removal of biodegradable or bioresorbable implant use 17999. Now this is unusual because it's referring you to an unlisted procedure code 17999. So if you have removal of an implant, a biodegradable or bioresorbable implant, which generally is not removed at all because it's just absorbed by the body, you're going to use 17999. So here's some definitions, and I kind of just reference that. Bioresorbable, biodegradable, it will break down and the body will reabsorb it. It doesn't have to be surgically removed. Non-biodegradable, it won't be absorbed over time, and it may just stay where it is It's not causing any harm, or it might have to be surgically removed. It depends on which particular kind of implant we're talking about. So let's move on to integumentary system. There were changes made to the wound repair section in this system. The 2021 introduction only stated that use of adhesive strips is coded using an E&M code, not a wound repair code. The 2022 introduction says, yes, adhesive strips used alone, but also chemical cauterization, electrocauterization procedures. These are also only reported using an E&M code. So that's a difference here. This has been added. Now they also made a change to the definition of simple repair. It's just to add hemostasis is included in a simple repair. Topical anesthesia is included, and these are not reported separately. So this is kind of a clarification for this. So that was integumentary system. Now let's move on to the mediastinum and diaphragm section. A note was added under unlisted procedure code 39599. Says for laparoscopic insertion or replacement of a permanent synchronized diaphragmatic stimulation system, see 0674T, 0675T, and 0680T. These, of course, are Category 3 codes. So these are new codes for laparoscopic insertion of new replacement synchronized diaphragmatic stimulation system. Why do you do that? To augment the cardiac function. So this electrically stimulates the diaphragm in order to keep the cardiac rhythm going. So 0674T, permanent implantable stimulation system, including the pulse generation and the leads. 0675T is just the leads, and the pulse generator is already in place, and so they connect up the leads to that. 0680T is the pulse generator only. So these are very specific to the parts of the procedure. Okay, so in the respiratory system, a new code was added for drug-induced sleep endoscopy. So the patient is sedated, put to sleep, and an endoscope is inserted to evaluate breathing and possible blockages. So 42975 is the new code, drug-induced sleep endoscopy with dynamic evaluation of the velum, the pharynx, the tongue base, and the larynx for evaluation of sleep disordered breathing using a flexible diagnostic endoscope. Underneath that are new notes. Do not report 42975 with 31231 unless performed for separate condition for a totally different reason, different diagnosis. And also do not report 42975 with 31575, 92511. So these are other endoscopies that it's referring to. 31231 is a nasal endoscopy. 31575 is a laryngoscopy. 92511 is a nasopharyngoscopy with endoscope, separate procedure. So you're not going to report 42975 with these codes, unless the 31231, maybe if it's for a completely different reason. Okay, so let's move on to the digestive system for esophagoscopy. The notes under codes 43197 and 43198, these codes are current codes, but they've changed the note. And where did they change the note? They referred you to some Category 3 codes. So what are those? Do not report 43197, 43198 for flexible esophagoscopy, diagnostic, or with biopsy. So do not report these with Category 3 code 0652T, esophagogastroduodenoscopy, 0653T, esophagogastroduodenoscopy with biopsy, and 0654T esophageal gastrostomy, insertion of interluminal tube or catheter. So it's saying you can't report these and these. Okay, esophageal myotomy. This is also in the digestive system, and this is called a POEM, a peroral endoscopic myotomy. This is a treatment for achalasia which opens the lower esophageal sphincter here, and you can see that it is narrowed. So it's a way to open it up so that food and liquids can pass more easily. So this is a new code. There's also a note under this new code. Do not report 43497 with 32665, 43191, 43197, 43200, 43235. These are other endoscopic procedures. It's a thoracoscopy, esophagoscopy, and esophagogastroduodenoscopy. So you can't report this with these. Okay, now let's look at the urinary system. An interesting change, it's interesting for me, I wasn't familiar with this surgery at all, is a periurethral transperineal adjustable balloon continence device. This device is for treatment of male stress urinary incontinence after prostate resection. You can see in this picture that there is no prostate, should be right there. So instead, they put these balloons in there that kind of squish against the bladder neck to prevent leakage. So 53451 is bilateral insertion, 53452 is unilateral insertion, 53453 is removal for each balloon, and 53454 is adjustment of the balloons. So new codes were added to the nervous system for the sections we're going to talk about in this video. The majority of them are in the nervous system. So we have new code 61736, laser interstitial thermal therapy, LITT or LIT, of lesion intracranial, including burr holes with magnetic resonance imaging guidance when performed, single trajectory for one simple lesion. Now, this is in the section for stereotactic procedures, but stereotaxis procedures use radiation to treat lesions. LIT uses a laser and heat to treat lesions, so that's how these are different. So the do not report note under 61736 refers to 20660 application of halo or stereotactic frame. So you don't use a frame for these procedures. Also included are LIT, computer-assisted stereotaxis, and radiological procedures. The do not report note under 61737 refers to LIT in the same codes as 61736. So this one, 61736 report refers to this one refers to that one, and then the rest of the codes listed here are the same for both. Okay, also in the nervous system are changes to the laminotomy, laminectomy codes. These are discussed more in the video on the 2022 changes to the musculoskeletal system. So notes were added under 63035, 63044, and code 63048 was revised. So the notes are here. Do not report 63030, 63036 with these codes in the musculoskeletal system, and these are for fusion procedures. So if the laminectomy is done to prepare the space for fusion, then you're not going to report them separately. That's kind of included in the fusion procedure. Another note says for decompression performed on the same interspace and vertebral segments as posterior body fusion that includes laminectomy, removal of facets, etc. See 63052, 63053. So some changes in these. Okay, also in the nervous system for laminectomy, facetectomy, foraminotomy, you have a new code 63052, the new add-on code, and 63053, also an add-on code. These 63052 is for posterior interbody arthrodesis. So it's when posterior interbody arthrodesis is done with laminectomy, facetectomy, or foraminotomy, with decompression, you can report this together. And 63053 is for each additional segment. This is for a single segment. So this is, so the nervous system and musculoskeletal system kind of combined here to refer to one another. Do not use 63053 with 63052 and use these with the fusion codes in the musculoskeletal system. Here. Okay, injections code in the nervous system were also changed. A note was added under add-on code 64484 to indicate the injection of contrast, imaging guidance, and localization are all included in codes 64479, 64484. They're included in the codes and not reported separately. So notes for the injection include all of this. Okay, also in the nervous system, you have neurostimulators codes. 64568 and 64575 were changed from incision 4 to open implantation. And this is for a cranial nerve, a neurostimulator, electroarray, and pulse generator. This is a cranial, and this is peripheral. Now the indented codes under 64575 are also changed because of the change in 64575. So they also have open instead of incision 4. Okay, more codes for neurostimulator. So these codes, we had codes before for cranial, peripheral, and now we have codes for hypoglossal. Hypoglossal nerve here, and that's here under the tongue. Open implantation of hypoglossal nerve, and this is a new code 64582. 64583 is revision or replacement of that neurostimulator. 64584 is removal of the stimulator. So these are all, so we have peripheral, hypoglossal, and cranial. Also, still in the nervous system, new codes were added for thermal destruction of the basivertebral nerves. This is a nerves in the implants of the vertebral body which send pain signals to the brain. And you see this here, kind of hard to see. 64628, thermal destruction of interosseous basivertebral nerve, including all imaging guidance, first 2 vertebral bodies. So this is for 2 vertebral bodies. If it goes more than that, you got 64629, each additional add-on code. Okay, so that's enough of the nervous system. Now let's move on to the eye and ocular adnexa. These changes in this section include cataract procedures. So there's a revised note 66982, extracapsular cataract removal with insertion of intraocular lens prosthesis. They added intraocular lens implant and concomitant endoscopic aqueous drainage device. And they deleted cyclophotocoagulation and code 66987. And the same changes were made to 66984. And there's a note under here. It added 6698789 for both of them, and also under 66984 reference to a category 3 code again. Okay, so new codes for extracapsular cataract removal with insertion of lens and aqueous drainage device. There's two possible codes. There's 66991, 66989. So 66991 is the kind of routine cataract removal and insertion of drainage device, the usual methodology. 66989 is when it's complex. Okay, so different codes, and you'd have to depend on the position to tell you whether it's complex or not, but they both refer you to this category 3 code. So what is that category 3 code? Well, this is used for insertion of a drainage device into the trabecular meshwork without external reservoir, without the cataract removal. So if you have these with insertion of drainage device, and this one is when it's only the drainage device and not the cataract procedure that's done. So it says specifically, don't use this code if they've also done a cataract procedure. So 0671T, insertion of anterior segment aqueous drainage device in the trabecular meshwork without external reservoir, without concomitant cataract removal, one or more. So here is the meshwork they're talking about, and you can see the fluid going through here. And there's an excludes note saying if there's a cataract procedure. So these codes are only for if there's no cataract procedure done, you use this new code. Now you also have retinal detachment. This code was also revised. It's in there now, but it was revised. 67141, prophylaxis of retinal detachment. And what they did was they deleted one or more sessions, which is interesting. And this was also deleted in the introductory paragraph, which stated one or more sessions, report once. So this means that the code can be reported more than once if more than one treatment is provided. So that's a big change. And it could be through cryotherapy or diaphragm therapy. Okay, the lacrimal system here. Revised notes to refer to a new code. The new code is 68841, but a note was added to 68741, closure of the lacrimal punctum, and 68815. The code hasn't changed, but they changed the note to 68141. So what's 68141? 68141 is to insertion of a drug-eluting implant. So an implant that gives off a drug, includes punctual dilation when performed, and it's inserted into the lacrimal canaliculi here for placement of drug-eluting ocular insert under the eyelids. See 0444T, 045T. So it could be here, and that's one code, and if it's in under the eyelid here, that's 0444T, 0445T. So different codes. Okay, 68841, insertion of drug-eluting implant includes punctal dilation performed into the lacrimal caniculus. That's here. And then it refers you to, in the note is new, but the codes are not. The codes were already there. 0444T, eyelid drug-eluting, 0445T, eyelid again. So this is initial placement or subsequent placement. So for insertion and removal of implant into the canalicus, that's 68841. So that's the new code. So where it's put in makes all the difference in the world. So a new section in the auditory system for osseointegrated implants. So these codes are for implantation of an osseointegrated implant into the skull. These devices treat hearing loss through surgical placement of an abutment or device into the skull that facilitates transduction of acoustic energy to be received by the better hearing inner ear or both inner ears when the implant is coupled to a speech processor and vibratory element. This coupling may occur in a percutaneous or transcutaneous fashion. Other reparative middle ear and mastoid procedures can be performed for different indications, and they can be performed separately. So here we have a device implanted and then an outside speech processor. Okay, so they deleted some codes and then they revised some other codes. Deleted codes for implantations of hearing devices referred to a mastoidectomy. So those codes were deleted. The revised and new codes don't mention mastoidectomies. Also revised 69714 and 69715 refer to implants using percutaneous attachment to an external speech processor. You see this here, speech processor here, and they put in a screw attached internally, and this goes right into the screw, which is fascinating to me. But they've also added some new codes. This is not screwed in, but these use magnets to attach external speech processors. So here we have internal magnet, external magnet, and the sound processor. So that's what keeps it in place rather than the screw we saw in the other picture. 69716, implantation with magnetic attachment to external speech processor. 69719, revision or replacement. 69726, removal. And 69727, removal. So a bunch of different codes for this. Okay, we've covered a lot. It's impossible to remember all these guidelines and changes, so I'm going to make some suggestions of notes to write in your book to help you remember. The last thing you want to do is be asking yourself questions or trying to look something up, read things carefully in the guidelines, the introductions when you're trying to take a test, particularly a certification test. Okay, so the introduction integumentary system closure repair section. Underline, highlight, write in, report chemical cauterization, electric cauterization, or use of adhesive strips only. Use an E&M code, not a repair code. Also in the integumentary system, you have 11981, and you might write in the definitions for bioresorbable, biodegradable, non-biodegradable. You might want to write those in. Another possibility is to write in your book 42975, drug-induced sleep endoscopy. You might write in that definition of sleep endoscopy. 43497, lower esophageal myotomy. You might write in that this is a treatment for achalasia. So what else might you write? Well, in the musculoskeletal system, there's some real changes. So you might make a note in the musculoskeletal section to refer you to the codes we've talked about in the nervous system. Now you might also write notes in the nervous system to refer you to the musculoskeletal system so that you have those right there. So let's look at the difference between these codes. Laminectomy, 33630, 33634. Then you have these codes: laminotomy, hemilaminotomy, partial facetectomy, and foraminotomy. And 63045 to 53 is just laminectomy, facetectomy, foraminotomy. Okay. And 63101, 63106 is just corpectomy. Other codes, 63001, 63017 for spinal stenosis include laminectomy and removal of facets. So just to keep straight which procedure is included in which code. Okay, also the codes for neurostimulators. So you might want to underline that 64568 is for open cranial. 64575 is open peripheral. 64582 is open hypoglossal. 64583 is revision hypoglossal. 64584 removal hypoglossal. So if you underline or highlight these, it catches your eye and you don't have to wonder read everything and figure out which code it is. You might also write next to 64628 the definition of the basivertebral nerve, the nerves in the implant, which send pain, the end plates of the vertebral body, which sends pain signals to the brain. So more notes to make. So implant into lacrimal system, 68961, 68815, 68841, implant under eyelid, 68841. We talked about that implant. And the osseo-integrated plants, underline the word magnetic for the new codes to help differentiate between those and the ones that are more of an implant, the ones with that we saw with the picture in a screw. Okay, so that completes this video. If you have questions or comments, please feel free to contact me. I hope to have more videos up soon. If you enjoyed this video, and I sure hope you did, please give it a like and subscribe, clicking on the picture in the lower right-hand corner of this slide. So again, here are the books I have written on coding, and these are available on Amazon, $25. The easiest way to find them is go to Amazon Books and type in my name, Tropin, T-R-O-P-I-N, or you can click on the link in the introduction to this video. Thank you so much for listening. I hope this was helpful. Thank you.